Hello, everyone. I'm going to call the April 29th Health and Education Committee meeting to order. And the first item, Carla, call the roll, please.
Commissioner Oliver.
Present.
Commissioner Davidson.
Here.
Commissioner Wilson.
Here.
Commissioner Boyd.
Here.
Commissioner McMurray.
Here.
Commissioner Gooch.
Here.
Chairman Dodd.
Here. Thank you. And thank you, Commissioner Gooch. Thank you for being present. Second item, Vice Chair Wilson, have you read the minutes?
Thank you, Chairman. I have reviewed the minutes of our last meeting. I find them to be in order. Without objection, I move for their approval.
All those in favor say aye. Any opposed? Motion carries. Thank you. Any public comments, Carla? The next item we have is Health Department. Mr. Blair, I see, is here. And we have the report and one other item, I believe.
Good evening, everyone. My name is John Blair, and I'm the Assistant Public Health County Director for the Health Department. Our monthly report is available on your screens. The Health Department continues to do good work to protect, promote, and improve the health of the people in Rutherford County. Our flu vaccines are free of charge at the Health Department. They are available during our walk-in hours between 8 to 10 a.m. and 1 to 3 p.m. Monday through Friday. I would also like to add that primary care appointments are available at the Rutherford County Health Department. Primary care services include treatment of acute illness and chronic disease management and are provided by a nurse practitioner or physician. Services can also include wellness exams, lab tests, and health education. We primarily serve uninsured and underinsured patients, providing accessible care to those with little or no coverage. We can also do telehealth appointments for many of our primary care services now. For more information on primary care or telehealth, we ask you to please contact our Rutherford County Health Department. We'd be happy to help. And that concludes my report. I'm happy to answer any questions if you have any.
Question.
Commissioner Oliver.
I was looking at your report, and it appears the STD rate is going up. Are we doing any type of outreach? Because it looks like it's zero outreach for the current month, but our month is higher than, last year's going up. So what are we doing relative to that?
Absolutely. Thank you for the question. So one of the things that this captures is it captures certain types of STD visits, but it also captures certain types of things from within our health department. What it doesn't often capture is things like health education, things like that. What we're actually doing, because we're a large county, and one of the things that happens in counties this large are all sorts of diseases and things like that. What our health educators do, and I also always try to shine a light on them, because what they're doing is they go into the jail, they go into juvenile detention, they go into schools, they go into churches, they go into the YMCA style places, they go to the Boys and Girls Clubs. And what we're trying to do overall is that they try to hit as many people as they can to do state-approved STD education. So somebody may come in to, for an STD visit, and we also do education when they come in the door, but we also typically, when that person has something like a reportable disease, that we would maybe want to call their contacts and make sure that we find out what's going on. We also make sure to educate all the contacts around. So it's one of the things that I don't want to call us one of our I'm trying to find a way to word it because it's STDs, but it's one of the things that the health department is very good at, and we're working on, and we continue to do good work on.
What age group are you seeing this primarily in?
So the age group, it varies. And we see it across all age groups, starting from young people and also to older folks. We haven't found that one particular group goes up. What we found over the course of time is that you'll get spikes, or you'll get a spike over here, and then we deal with that, and then you'll get a spike over here. It's not just based on one particular age group.
Gotcha. Thank you.
Yes, ma'am. Yes, ma'am.
Yes, Commissioner Davidson.
Mm-hmm. No. No, and it's one of the things where we're in the middle of, this was something that we're doing. One of the things that I'd like to talk about, and I think would be good to kind of let everybody know, is that Smyrna, we still see, all sorts of appointments. What we've done, though, is that we've moved more of our WIC services up there, because WIC, I don't know how much you guys know about WIC now, but a lot of WIC can be done over the phone. And so what we're doing right now is we're doing a lot. We've noticed that that particular corridor has really grown in terms of needed WIC services. So what we've done is we've moved more staff there, and we've got nurses, we've got nutritionists, and we've got a whole crew as an entire clinic team that are working to help do these services. And what we've done, one of the things that I'm most proud of, is that we did a lot of WIC appointments before in Rutherford County. What we did was we did about 120 a day. And that's a lot. Every WIC appointment may be, it may be 30 minutes, it may be 45 minutes, it may be an hour. What we've been able to do by sort of working on trying to make things more efficient is that we've gone from 120 to 180 patient slots a day. So that is 60 extra babies per day that are getting care, that are getting to see a nurse, that are getting to see food and things like that. As far as immunizations go, what we are doing is that we have 2 nurses there that can give immunizations, but what we're typically doing is that it's a really good opportunity for them to get their WIC services, and then we can spin around and get them another appointment inside the Murfreesboro Health Department, where we have a full-time dentist, we have nurse practitioners, we have all these things. We can get these moms and these kids when they're young and get them all these services, and it's an idea of getting them healthy young and keeping them healthy, but it really takes, just like it takes a village to raise a child, it takes an entire health department to give all the services that we need to do. So we still do immunizations. We're still working on ramping that up in Smyrna, but what we've done is we've really increased the WIC, and you might notice we've increased it by a lot. And then Murfreesboro has compensated, at least for right now, to basically spin up the work of doing more immunizations inside the Murfreesboro clinic, and then we're just giving it as the child or as the mom needs.
So if we,
Mm-hmm.
should we go ahead and refer them?
So they can call either one. We will help, and if they need WIC services and they want to come to Murfreesboro, we're going to make sure they get helped. We know that not everybody has easy access to a vehicle, or they may not have enough time to, if they live in Murfreesboro, they may not want to drive to Smyrna. So we honor that completely, and all they have to do is that they can call either location, and we're going to get them helped.
One more question. And I know I asked this to Director Cumby maybe, I don't know, a year and a half ago. Have you all thought about expanding services in the northern part of the county, or looked at logistically how you could possibly do that with maybe another building or anything like that?
Again, that's another really good question, and that's one where in the future, I think we all know where a lot, and I'm not saying the other places in the county aren't growing, because everybody knows everything's growing all together big. But the I-24 corridor going towards Nashville feels to us where we're getting a lot of our patient population explosion from. I think in the future, I don't want to speak out of turn. I never want to speak for the mayor's office or the Department of Health. This is just John. I do think it would be good in the future, but as we all know, land and a building and staff to staff it aren't cheap. So I can see the need for it in the future, and I would love to be able to work with the new county director and see what can be done, because I really think, just like there's a large population in Smyrna, there's also a large population in Laverne that's also having to drive to Smyrna right now, and maybe in the future there's something that can be done to make that happen.
Mr. Blair, quick question.
Yes, sir.
I know last month you, and forgive me if I overlooked it, there was one measles case last month or so. Is that case still there? Or have we had any additional cases here in
Yes, sir.
Rutherford County?
What I'd like to do is, there was a recent press release that I think would be very useful to just kind of to run off of and give you the most accurate information. Tennessee's total cases of measles during 2025 is 6 confirmed. So the last time that we had that I was here and we had that conversation, I believe there were 2 in Tennessee. Okay. And we're to 6 now, so that within the course of a couple of months, there hasn't been that much growth. So both confirmed cases, or excuse me, all the confirmed cases that we've got are cooperating with public health officials by quarantining at home because of known exposure to previously confirmed cases in Tennessee. The Department of Health is not currently aware of additional exposures related to the newly confirmed cases. There's no evidence of sustained measles transmission in this community or the state of Tennessee. So as of right now, that's the press release that's been given. I think that's the most accurate information we've got right now.
Could you put into layman's terms when you say sustained?
Sure. So again, I don't want to, this is just speaking for me, not for, when you're talking sustained transmission, you're typically talking about someone who is going about all in the community, and then so you've got a transmission here, and then everybody around them gets sick, and then that person is going all sorts of places. And what you're seeing is kind of an unbroken chain that you can trace from A to B to C to D. We really aren't having that right now because the state of Tennessee and the Department of Health have really done a very good job keeping everything contained, and the people, for their part, are doing a really good job staying quarantined, so that sustained transmission of point A to point Z is not really happening.
Thank you.
Yes, ma'am.
Thank you, committee.
Motion to approve.
All those in favor say aye. Motion carries. Thank you, John. You had your next item?
Thank you. So next, we'd like to present a cooperative agreement between the City of Murfreesboro and the Rutherford County Health Department. This agreement has been previously in place, but it expired this year. This agreement would allow the Health Department to use the Patterson Park Community Center at no cost to the Health Department or Rutherford County government to host our yearly community baby shower. This agreement was a requirement of the City of Murfreesboro. Our community baby shower, tentatively, we're in the stages of planning right now, and we're getting that locked down, but tentatively it's going to be held on August 23rd, 2025 this year. This agreement will run from that date and last for a year. Most of our folks in town, because we've been doing the community baby shower for about 10 years, most of them have seen it or have heard a little bit about it, but I'd like to give a shout out for that. It's a really good event every year where we work with businesses and we work with other government agencies and we work with United Way and we work with all these places. And we have an event where we typically do it at Patterson Park, and we give health education, we give education for new moms, like how important it is for a baby to sleep on their back, and you know, all the things that new moms need. We also give them diapers, wipes, bottles, onesies, all these things for either expecting moms or new moms. And it has really, we started off with maybe 100 people, and now we've gotten up to typically around 50 or 60 vendors and maybe 500 or 600 people, you know, expectant moms and other parents and grandmas and things like that all show up. But anyway, it's a really good event for us, and I think it's a good relationship we have with the City of Murfreesboro.
I agree. It's an excellent event, and it's a wonderful community service. Has anything changed in the agreement that we need to kind of look at, or is it typically the same one, and it's just renewing the dates?
I looked through it, and there's nothing that I was aware of that looked any different. It looked like the same agreement. It just the old one expired.
Do you need us to make a motion for you to be able to sign it?
Yes, please.
Motion to approve.
Second.
Thank you, Phil. Everybody seconded. For this item, we'll go on the roll as it pertains to property. So, any other discussion? I jumped ahead. If not, call the roll, please.
Yes, sir. Commissioner Wilson,
Yes.
Commissioner Boyd,
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch,
Yes.
Commissioner Davidson,
Yes.
Commissioner Oliver,
Aye.
Chairman Dodd.
Yes.
Thank y'all.
Thank you, Mr. Blair.
Thank you all. Have a good one.
Community care is the next item. Their minutes are on your SharePoint. I did notice that in order to stay competitive, they are going to do a salary study, so be aware of that. They presented their budget, and the mayor was present, so if you have any questions there, we can reach out to them. Otherwise, we will move on to the school board. I know Dr. Sullivan and Dr. Martin have policy meetings tonight. So they're at those meetings, and they intended to be here soon, prior to 6 o'clock. And so Mr. Runyon can go ahead and begin with a textbook amendment. Brian, welcome.
Thank you. Good afternoon, Commissioners. Brian Runyon, CFO, Rutherford County Schools. This amendment that I have in front of y'all is Fund 141 budget, fund balance budget amendment. This budget amendment is to reflect the state of Tennessee moving from a 6 to 8-year textbook adoption process. In order to balance RCS's Fund 141 GP budget, the textbook line item was cut in FY 24-25, and the intention to use Fund 141 unassigned fund balance was communicated previously regarding the purchase of science textbooks. This amendment will decrease Fund 141 unassigned fund balance and increase expenditure account 71-100-430 bound textbooks in the amount of $6,654,414.
Mr. Gooch.
So to make the budget balance last year, the textbooks were cut out.
Yes, because the state of Tennessee moved to an 8-year process, or an 8-year textbook adoption. It gave us another year to be able to go where we didn't have to actually put it in the 24-25 the beginning budget, and we knew that when we added additional funds to our unassigned fund balance, because we ended the year in a surplus, that we were going to use that money to pull out this year in order to be able to pay for these.
And do you just, off the top of your head, do you know how much money was put in the unassigned fund balance for thing?
It was somewhere between 8 to 10 million.
Mr. Chair, I'll go ahead and put a motion on the floor to approve the transfer.
We have a motion.
Second.
Second by Mr. Boyd.
Question.
Ms. Oliver.
So for clarity, you're saying that last year you removed funds from this account because you didn't think you were going to need the books then? Is that what you're saying?
No, we just didn't, but we knew we were going to need them, but because they moved from a 6 to an 8-year textbook adoption, we knew we didn't have to put it into the 24-25 original budget when we came to the commission last year to ask for money. We knew we were going to need it, but we wanted to have that money roll into fund balance to where we knew we actually had it, and then we could pull it out at this current
The
time.
out of fund balance back to
Correct.
this particular line item.
Correct, and we're also using it. It's going to be for the 25-26 school year. But we're trying to get a jump start because of every other district in the state has this textbook adoption too, so we're trying to get a jump start on that so we can do some training during the summer for each grade band, and then also be able to get these science textbooks in before the school year starts next year.
Thank you.
And your board voted on this? Was it unanimous?
Yes, they unanimously voted to approve it. So,
I see no further discussion. Call the roll, please.
Yes, sir. Commissioner Oliver?
Aye.
Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner Boyd?
Yes.
Commissioner McMurray?
Yes.
Commissioner Gooch?
Yes.
Chairman Dodd?
Yes. Thank you. And I know you're not prepared to do any of the
I've been with him all
board
day.
updates.
I've been with him all day, but I am going to let him speak to that, and
Yeah.
he should be here soon. They're on their way right now.
Very good. You can tell me, has your working group, your board, have y'all had some good budget meetings? I know we are going to be, joint meeting is next month.
Yes, we've actually sat down with multiple department heads and, for lack of a better word, cut our budget down to, we've also spoke with Michael Smith, the finance director here, of where he feels comfortable with presenting our budget to the commission, of where he thinks it's going to be most accepted at. So we've gotten very close to what he suggested, due to the fact that, we're also funding additional expansion in the charter schools that we currently have. And then also with, the increase to transportation line, we're going to still have to budget into a deficit this year, but it was closer to the amount that he suggested that we be at in the deficit. So we have actually sat down and spent, I don't even want to try to guess the hours of just sitting there, talking and seeing where we could cut in the rest of our budget. So it's been very good, though.
Mr. Gooch.
Is the deficit able to be covered with the ending fund balance?
Yes, we're actually, essentially what it'll look like is the budget's balanced, but we'll be using a certain amount of the fund balance in order to be able to balance it.
But do you know off the top of your head what percent that would leave for ending fund balance?
Well, depending on what we end up with putting in fund balance again this year at the end, currently right now with this budget amendment that's going to happen with the 6.6, that's going to leave us at about a 15.7%. So, I mean, talking with Michael, he likes to leave it around to 18, 19, 20%. I don't know exactly how much we're going to put into fund balance this year. I would say it would be somewhere similar to last year. So probably somewhere around 18, 19% if everything works out the way it's supposed to.
And just one more question. Has the board finalized the bus contracts as far as?
That was I was doing a little delay tactic here because I've asked Dr. Sullivan to update us on the bus contract. So very timely question. Yes, yes. So Dr. Sullivan.
Perfect, sorry.
Yeah.
Got here as soon as I could. We got stuck on headlights of all things to talk about on policy. All right, so where we are.
Mr. Gooch just asked for an update on the bus contract.
And let me kind of address, so part of the textbooks, I hope, was it approved, I hope? Yes. Okay, good, thank you. Part of the textbook portion was what we talked about last year. It's how we lowered our budget. And then you'll see then last fund balance portion, you'll have another amendment next month for 2.7 for computers that we also used to be able to balance last year's budget and this year's budget. I'd feel better around 16 or 17% is what I think, just looking at it. Brian sees the numbers more than I do, and Michael. I know he likes it higher, but that's kind of where I see it. Let's kind of get, you want to go just straight into where we are as of right now, or how do you want to handle it?
Bus contract was the item that I think I think we'll dispense with it, well, unless the committee wishes. Any update on enrollment, normally we'll discuss enrollment. So if you can touch on enrollment.
Yeah.
We've done the amendment, and if there's any other
Yeah.
Board of Education items you would like to share,
Yep.
and we'll conclude with the bus contract.
Enrollment is pretty similar. ESL growth has slowed. It is still growing. I think we expected it to possibly decline. It has not declined, but it has definitely slowed. For example, we grew from the month of March to April. You do have spring break in there, 8 English as a second language students. We were averaging 20, 30, 40 even some months, so 8. So we are still growing. Sorry.
You did anticipate it slowing down considering the
did.
current climate, didn't you?
Correct, we did. We anticipated that, but honestly, we probably anticipated a decline, and we have not seen a decline. We're up several hundred still since January. And so 8 was much slower than it had been.
Excuse me, are your positions filled? Your English as second
Yes,
language teachers, how you doing?
We're still great on positions. Great. Which is, again, can't be said everywhere, and so that is what we try to highlight all the time, that our positions were outside of special education, not having a hard time filling positions. Special education is still tough because there's not a waiver real process to be able to fill special education. And then education assistant positions, especially in special education, are still tough. So. And then Board of Education updates, of course, we're in the middle of budget process. We'll get into transportation in a second. We right now have scheduled a budget workshop for May 6th. That date may change either to Monday or Wednesday. We may have a special called meeting to discuss parent responsibility zones, which I'll talk about here in just a minute as well. Budget-wise, we are looking somewhere between $8 and $10 million in the deficit, which has kind of been our target all along at looking where we are. Transportation, I know, is the other big topic. Board last week, as all of you know, had offered 17% and then a 2.5%, 2.5%, 2.5%, and $4,000 for insurance. The board motion included those items and included the request to go to County Commission and Risk Management to talk about the RFP for insurance. So that is still working with Jeff Reed to see what the appetite is for that as a possibility. I know there are definitely, that's still being played out behind the scenes, whether or not that's even a possibility. The other part of that is, and we have a message going out, our school board attorney is with our school board right now, and I know that the Bus Drivers Association has a message going out here in a little while, and so I'm, good news front, happy to report that we expect full transportation service on Thursday, and so that is very good news. So thank you to our contractors for continuing with our contract that is signed. So I know that that's tough when we're on a negotiation standpoint, but that's the right thing to do on a current contract of where we are, regardless of how we feel about next year. So bus transportation should continue as we have. The other part of that is in the motions last week, something we looked at last year when my recommendation to the board was 10%. Our board definitely, rightfully so, felt like our bus contractors needed more and went to 17%, which I fully support. And looking at trying to save money, approved something that I definitely recommended in the past was a parent responsibility zone. And looking at that the last couple of days and talking to our individual board members, and then looking at it internally, we're going to recommend that we pause that for a year. That has to be voted on by the board. So I've talked to every board member internally, but that has to be voted on by the board. So I'm going to recommend it, but that we can't say officially that that is tabled until the board votes on that. So that is why I'm saying that there could be a special called meeting, but I have to have a quorum to have a special called meeting, and I know not everyone is available next Tuesday for our budget workshop. So that date could change Monday, Wednesday, depending, because then there's a budget meeting with the commission on Thursday, so I know it will not be that date. Do I anticipate the parent responsibility zone in some shape or form in the future, it being a recommendation by me? Some shape or form, yes. I will tell you there are two main districts It is really a model across the state. It is a model across the country in a lot of places. What we started looking at, though, was we needed to look at some other things, see what makes sense for a parent responsibility zone. It got lost that this is requiring kids to walk everywhere, and that's what the media blew out, and that was never what our message was. Kids need to walk to school. And what we can do as a district is we can change school zone times, so we can move school start times up. So to where elementary starts at 7:30, we can move those to 7, and that allows schools to open at 6:15, which allows parents to drop them off earlier. And then that allows us to partner with Boys and Girls Club, YMCA, a lot of different things we can do in the afternoons to help. But that was never part of the narrative, and that wasn't part of something we were ready to discuss on last Thursday either. And so that type of thing needs more study and needs more time to be able to discuss. The other part of that was making sure that we have some stipulations in place for ourselves over what makes sense for a parent responsibility zone. And for example, we really like what Clarksville Montgomery has. That's kind of the model I'm looking at. Clarksville Montgomery's is if the neighborhood or area has to cross 4 lanes of traffic and there's not a crosswalk or a crossing guard, then that area is not included in the parent responsibility zone. So it may be half a mile from the school, but if you go to their website and pull up their map, it's completely cut off. So that part is not included. The neighborhood doesn't have to have sidewalks. It's all controlled by the speed limit and the road width. And so those are things that our planning commission, or not our planning commission, our planner at the school system is going to use with our GIS and try to start developing maps to see where it makes sense and where it doesn't make sense. All that to say, it's going to be our recommendation to table it for a year. I do envision it coming back in some shape or form, but I don't know what that shape or form looks like till we have a lot more discussion and a whole lot more just input to see what makes sense and what doesn't. Will it make people happy when we implement it? Absolutely not. It will not make people happy because it's going to upset people that are used to having transportation. But we are not to the point that we can provide the transportation like we have, not just from a financial standpoint, but also from the contracting standpoint. The other part I emailed to the board last night was the real possibility exists that we have a large number of contractors that don't sign on for next year. That's going to be de facto create a parent responsibility zone to where bus service is not provided. That will shift our routes to where we now have a parent responsibility zone because we aren't able to fill routes. And so that's going to work hand in hand with each other to where we have to service certain areas to where we can only service. So happy to answer questions. I know that was a lot.
Question.
Yep.
Is there a reason why these considerations were not taken into account prior to that decision, calling for that vote and getting the community all up in arms?
They were the year before. A lot has been discussed, but definitely could have been more conversation that day of. Definitely agree with that. But I do want to also reiterate, I greatly appreciate the board voting for that night because they were looking at it from a financial stance. And they were looking for a way to provide more funding to our bus contractors without asking the county commission for a way to fund it. So that was the mindset that night. So I think then that created unintended consequences.
And so, Dr. Sullivan, it was voted on and passed specifically, so a recension vote would have to occur. Okay?
And I called every board member individually today and said, so there will be a video going out between 6 and 7, or 7:30-ish. These videos are not fun, but I think it's important instead of a recorded message to do a video to show humanity to the community as well, talking about this and contract where we are. I had 2 videos recorded depending on what happened with our contractors on Thursday, so glad to release the different version. Again, thank you guys, so glad to release that version. And so talking about both of those, that it will be our recommendation, but again, thanking the commission, the mayor's office, county finance, all of that, because we've had a great relationship the last 3 years, and being able to figure out a way to work through all of this, because that's what I am confident in, is regardless of these painful conversations, because this is the last week, it's only been, not last week, the last 5 days have been extremely painful, but it's brought up a lot of conversations that we've been able to see what truly is the cost benefit of pulling transportation from certain areas versus what your purpose is. And it's just been good conversations.
It's been painful for some of us as well.
Mm-hmm.
Because what I've had to explain to citizens is we don't devise your budget.
Right.
We don't allocate how the school board spends their money.
Right.
And so that comes, they need to see their school
Correct.
board
Yep.
official with regard to that, and not the county commission. And the school board officials or board members should not be telling them to contact your county commissioner.
Right.
Because I can't tell y'all how to spend y'all's money. Okay?
Yep.
If I could as well, I want to thank you for making your video and
Yeah.
putting it out there to the community so that they do realize that we work together very well.
Absolutely.
I feel like this commission and this committee, we try our very best
I
to
agree.
give the schools exactly what they need, when they need it, when we can. And so it is upsetting when things happen and you're getting emails and phone calls and people are yelling at you that you need to do more for the schools. You're not giving them enough. And it's like, but I give you what you ask
Yeah.
for. I don't know what else I could do. And so I do appreciate you standing up for us as well.
Yeah, thank you.
When I send people back to the school board, I try to be as polite and respectful as I can because this is a partnership. No one should be upset and attacking anyone else. I know tensions run high there, but I want everyone to understand that we do work very well
Correct.
together.
Yep. And again, I greatly appreciate it. Thank you. And I do want to make sure that I stand by, like our school board was trying to do the right thing and trying to find a way to find extra money for the bus. And that's truly what it did. It was trying to find a way to find $3 million to fund the extra routes and the additional 7% roughly. So that's where it was coming from.
So if a bus contractor signs the contract and then in a few years there's these parent opportunity zones,
Yeah.
responsibility zones, a contractor's contract can be taken away or their bus route canceled. Is that
Bus
correct?
route can be moved.
It can be moved,
Yes.
but they
Yeah,
would
bus
still
route can
have
be
a
moved, yeah.
route.
It's within the contract of what can happen, like elimination of routes and all those different types of things. But we also know for the next year, we are adding a middle school, so there'll be additional routes as well.
That makes sense.
Yeah, and you guys will, if you don't mind, sorry.
No, go ahead.
The other part you were going to see is we are going to look as well at, and I don't want to, but it's something we have to be prepared for at our May 15th agenda. Depending on what happens with bus contracts, we very well may have to look at buying 8 to 10 buses, releasing an RFP for services, because we have to have backup plans in place if we aren't able to fill routes. And we don't want to go down that route. But we have to be able to provide transportation services to as many kids as we possibly can. But I do think it's a high likelihood that we have areas that we're not able to at the beginning of next school year, that we just have to be upfront with parents, that we will limp along and then get back to full as quickly as we can.
I was going to ask that question as well because it was brought to my attention that you all had plans to purchase buses, and so I kind of wanted to ask that question.
Yep.
And explain again what those buses would fulfill.
They would fill routes that we weren't able to fill.
And then you would hire drivers. Is that the
Yes.
plan?
We would hire 8 to 10, however many buses were available. So that's.
And is this in lieu, or is this because you don't feel like the contractors will accept the contract?
We've had several, and I don't want to speak for them, who have said the insurance is the main issue and that without the insurance, they will not drive. And so I have to take them at their word for that and say that, while I hate that, I have to start planning accordingly because I do not see an avenue for bus contractors to be back on county insurance before the school year starts.
And so where are you again with that RFP relative to the liability insurance?
It would have to go through the county. It was not on the county's original risk management RFP, so it would have to be re-released, and from my understanding, that would be at least a 60-day process. I don't know, were you able to speak? So it's going to be at least 60 days, and Jeff Reed, our school board attorney, has handled all of that with risk management, because that's strictly county, not school system. And that's the part that's hard, is that you have if we purchase buses, and those drivers are covered because they're covered under our county insurance. The other aspect, though, is you have contracted services, and no other contracted services are covered under county. And so I see both sides to that argument of contracted services. Why are we covering contracted services under county insurance? And so definitely two sides to that. And no, I would definitely, like if you asked me and said, do you want to be in the bus business? I do not want to be in the bus business. I do not want another department to manage. Hands down, we are way too big anyways. I don't want another department to manage.
Mr. Gooch.
Okay, thank you. I'm
Sorry.
curious. That's okay. So on the second year, the 2.5%, is that a 2.5% including the already 17%, or was that a 2.5% based on with the original contract?
It's 2.5 based on what this year's is.
Okay, so it's not 2.5%.
Based on
On
the
what the
original
17%.
amount. Yeah, it's 2.5, so it is their rate currently plus the 17.5, and then the 2.5 calculated on their amount now and their 17.5. So it is it's more than 2.5, yes.
So do you know the cost of 2.5%?
I do. 17 and 2.5, sorry, I think I said 17.5. 17, then 2.5.
Well, the first year,
First year's 17.
But my question is the second and third and fourth year.
I do.
Of 2.5, is that 2.5% of what they're getting now, or including the 17%
It's
off?
2.5 of what they're getting the next year, of this coming year. And so, but I have that calculated. Second. Now, this won't include anything with new routes, because I don't know the number of new routes I'll have the next year.
Gotcha.
Just a second, because it kicked me off, because I closed it. Yeah. Next year, so this first year is the heaviest, 17% is 4.6 million.
Is the increase, Dr. Sullivan?
Yes.
Trey's, it's the
the
increase
4.6
on top
is
of
the
27 million, or whatever you are.
Yep, plus 1.4 for insurance. The next year is 794,000 plus 1.4 for insurance.
So the 794,000 is a 2.5%.
Yes.
And that's
The
794 would be for the third and fourth year.
next year, because then it builds every year, because off the next new amount. So the third year is 814,572. And the fourth year is 834,937. So,
Could you say the third year?
Yep. So third year is 814,572. And then the fourth year is 834,937. And then each year you would add 1.4 million for $4,000 stipend for the insurance.
So it does account
every year.
for the prior year's
Correct.
raise. Okay.
Yep. So roughly about 12 million over the 4 years, but the biggest amount is this year.
Another question, you talked about possibly changing routes and things of that nature. In doing so, I guess, could you consider maybe having drop-offs and pickups like at the front of a subdivision? Because I know where I am, it seems like every half block they're stopping. I mean, can you have less stops by having more centralized areas where the kids go?
Great question. So we have looked at it. One of the biggest, I hate to say issues, but problems, is that from a liability standpoint, school, if we assign a bus stop, we are responsible at that bus stop. And so by spreading the students out across more stops, we limit the risk of student misbehavior. And so if we put 30 kids at one stop, and they get into a fight, we assign the bus stop, we're liable for that behavior. Williamson County, for example, they do a hub type scenario, and they assign staff to go to those hubs. That would be cost prohibitive for us to be able to do for what we are looking at those things. And then I have a staff member at somebody's house. There's all kinds of, we're just not ready for that yet. But great, yes, we have definitely looked at that type of thing. Because yes, it drives people crazy too. Like, why'd you stop 3 houses down? I'm like, well, because that's an extra stop where I got 2 kids.
Like
compared to
door-to-door
1 kid.
service.
Yeah. We do 0.2 miles is what we try to do, but in some of our most dense areas, it can be 5 houses to try to keep the number of kids separated.
Thank you for the update.
Yeah, I want to thank Brian. Brian and I have been attached at the hip for the last couple of, he has done an amazing job of every crazy idea I come up with, run this scenario, run this scenario, run this scenario. So greatly appreciate you. You've been awesome. He's been awesome. I mean, I've come up with some strange ideas the last couple weeks. So.
And we will be looking to hear from you and Ed Elam's independent of you, I know, and the governor signing a bill or not. So we'll be listening to what may come next. I know y'all have a lot of moving pieces. So thank you for the update. Absolutely.
Last thing I'd like to just add. Next Thursday, Dr. Martin and Brian will be here. I promise you I'm not trying to dodge. Next Thursday's budget meeting, or budget committee. I am not trying to dodge budget, I promise. And I want to be here to present to budget, but next Thursday is the year anniversary of Asher's accident. And so I need to be with my family next Thursday. So that's where I need to be. So, sorry, I've told Dr. Martin, I've told Dr. Martin and then James and Brian both. I said, I think I'm going to be at budget. And they're like, you're going to regret it and your wife is going to hate you. And I was like, I need to make sure I get the votes to get through with our textbooks. They're like, you will regret that. So I promise budget, if you're watching, I'm not trying to dodge you. I need to be with my family next Thursday. So that's where I am. So,
We will support that, and I think Mr. Gooch will support that on. Chairman Phillips has a comment to make. Jimmy, before you step away, please.
Thank you, Dr. Sullivan and Mr. Runyon both. You'll present the budget
correct.
To this committee.
May 27th.
The joint meeting, it's May the 27th. I know you already do this, but I'd like to expand upon it a little bit. Your budget is divided into sections, and then each of those sections have line items that consider that section. You also compare this budget to last year's budget and maybe even the year before that. All of those things are good information. What I'd like is to expand the difference between the proposed budget this year and then this current year's budget, and the line items that are affected and what the difference is. So be prepared to discuss that at Health and Ed, and then at the full budget both. Whatever that section is, if it's more than this past budget, why it's more, and especially the line items that are affected by that. And then just to add that a little bit, some of the line items that may have not been utilized this year, why weren't they utilized, and what you're doing about it next year.
Sounds great.
Does that make a certain amount of sense?
We're used to that. Yep, we're used to it. This is my, I guess, third time through, third and a half. So
that's a little more.
3.5. I'm happy to it. I will tell you that
it's a little more scrutiny, and you're good with that, Brian?
Yeah. I will tell you this year's budget has additional funding coming in because what you will see has additional charter school funding coming in. So we get the TISA funding for our charter schools that then gets sent to them. So you're going to see, like, TISA sends us right now 22 or 23 million, but a lot of that is then a transfer out. So it is going to look like a huge budgetary portion, but then gets transferred out. The other portion that in July will make our budget look absolutely huge, just so that you're aware of it, is every teacher that taught for us this previous year will get an additional $2,000 as part of the education savings voucher account that was passed last year, and that is going to be transferred into 141 for 1 year, and it is going to, as big as we are, be a multi-millions of dollars budget amendment that then gets sent to every teacher. But it's not a local match. It's going to make our budget look like, but I hate when it gets passed through into 141 because it makes your budget look like, what'd you guys do to blow your budget up an extra 12% overnight? Nothing. It's being passed through just like the Innovative Schools Model Grant that was $17 million. All of that makes your budget look like it's increasing more when it's state money that's passing through. So just be aware of that. Yep.
Thank you both. Thank you, guys. That concludes our agenda. I will entertain a motion to adjourn. We are adjourned.